Good afternoon. I don't have slides, so less work for your eyes and more for your ears. Thank you very much for inviting me to this very important summit. I listened to some of the presentations, and I'm going to give you a perspective of what is happening in Zimbabwe and maybe in Africa in general. We gather here not just as representatives of our nations, but as stewards of our planet's future, committed to addressing one of the most pressing challenges of our time, that is climate change and its profound impact on health. Unfortunately, climate change is not merely a theory, it is our harsh reality. Our generation has been born witness to its devastating impacts, suffering its consequences daily, rising temperatures, extreme weather events, and the spread of infectious diseases increasingly straining our health systems. The projections are alarming. If we do nothing, the situation will only worsen. Today I'm here to showcase how Zimbabwe and Africa are responding to these climate-related health risks through robust national policies. We must all agree that the time for denial and complacency has passed. Urgent action is required, and I stand resolute in the belief that Africa, despite its minimal global emissions, must also lead the change in addressing these challenges. My presence here is also a testament to the strong diplomatic relations between Zimbabwe and the United Kingdom, reflecting our unison in facing the challenges that affect our people. Zimbabwe is deeply committed to the Paris Agreement, reaffirming our dedication at COP21 in Paris. Our nationally determined contributions serve as a roadmap, integrating health as a vital component of our climate mitigation strategy. By embedding health into our climate action framework, we align our vision with Vision 2030 and the Sustainable Development Goals. To demonstrate Zimbabwe's and Africa's commitment to addressing climate impacts on health, Zimbabwe hosted the first Climate and Health Africa Conference from October 29 to October 31st last year in 2024. This landmark event brought together nearly 500 delegates from 34 African countries and 48 countries worldwide. At this conference, all delegates and policymakers co-produced the Harare Declaration for Africa, which outlines 6 priority areas. These priorities need to be urgently addressed to advance progress towards protecting the health and well-being of the people of Africa. These priorities are: 1, capacity for African-led research, training, and knowledge generation on climate change and health. 2, inclusive dialogue between science, policy, community, and youth for effective research and action. 3, dedicated, sustained funding from international and national sources, specifically aimed at investment in research and national programs to build resilience and protect people's health from climate change. 4, robust monitoring and surveillance system to track the health impacts of climate change. 5, cross-sectoral engagement for climate resilient systems for health. And finally, 6, participation and influence of African health experts in the COP processes. These priorities emerged from thoughtful discussions during the conference and need urgent attention to advance progress towards protecting the health and well-being of the people of Africa. Post-conference, Zimbabwe has established a national technical working group on environment and health. This group comprises representatives from all government sectors, civic societies, and the private sector. Its aim is to provide advisory support to the government of Zimbabwe on issues arising from the climate and health nexus, helping to shape policy and maintain climate change considerations. It is essential to recognize the profound impact of climate change on food security, which directly affects health outcomes, particularly among vulnerable populations in resource-constrained settings like Zimbabwe and Africa at large. Food insecurity exacerbates malnutrition and increases susceptibility to diseases, further straining our already limited health resources. Addressing these interlinked challenges is crucial for safeguarding the health and well-being of our most vulnerable citizens. Our commitment to action is reinforced by our participation in international forums. At COP26 in Glasgow in 2021, Zimbabwe committed to the Glasgow Climate Pact, emphasizing health-related actions such as transitioning towards sustainable, low-emission healthcare systems and ensuring that our health systems are resilient in the face of climate shocks. The commitment made at COP26 will continue to inform our national strategies, and it is crucial that we as African leaders ensure these promises are realized through concrete actions. Moreover, at COP28 in 2023, Zimbabwe again took a leadership role in the global climate health dialogue, signing key declarations that reaffirmed our commitment to building resilient health systems. These actions are part of a broader global effort to ensure that health systems are sustainable and capable of withstanding the rising challenges posed by climate change. As we share our experiences, it is essential to highlight both the contrasts and commonalities between our appropriate approaches in Zimbabwe and those in the United Kingdom. While our contexts may differ, our shared goal remains the same. That is to protect human health in the face of climate change through a variety of mitigatory interventions, which include 1. Climate change mitigation with health core benefits. 2. Adaptation measures to protect health. 3. Health system strengthening. And 4. Policy and community interventions. The United Kingdom has made significant strides in integrating health into climate policy, and we can learn from these successes. By sharing knowledge and fostering collaboration, we can innovate and inspire ambition for integrated action across our respective settings. As Africa, we face a monumental task, but we are not alone in this fight. The Africa CDC has initiated a climate change and health program that aims to address the nexus of health and climate across all 55 member states of the African Union. Together, we will reinforce climate-intelligent disease surveillance systems, conduct vulnerability assessments, and develop national health adaptation plans. The declaration sets forth a decisive call to action, outlining required actions from policymakers, funders, academics, and researchers, program implementers, communities, women, and the youth to respond to the pressing challenges of climate change on health in Africa. We must work together, pooling our resources and knowledge to ensure that no country is left behind. Zimbabwe has also established climate and health demonstration labs through Sesha Zimbabwe, which are crucial as they provide evidence for policy actions and are invaluable as we strive for effective interventions for vulnerable populations. At the heart of all these efforts lies one critical element, that is leadership. Effective leadership is essential to drive integrated climate health action. Leaders must champion the cause, inspire collaboration, and build coalitions that span sectors and borders. It is also vital to engage youth, women, and community voices, ensuring that solutions are inclusive and representative of the needs of all. As leaders, we have the responsibility to set ambitious goals, allocate necessary resources, and foster an environment where innovative ideas can flourish. This is not a challenge that can be met by one nation alone. It requires a united front, with each of us playing our part in a collective effort. In conclusion, I urge all of us to commit to bold actions, solidarity, and respectful partnerships. The outcomes of this summit will resonate not only in Zimbabwe, but across Africa, influencing global climate health policies. Let us embrace our roles as guardians of our people's health and well-being, ensuring that our future generations inherit a planet that is not only habitable, but thriving. I thank you.
Dr. Mombeshora, please come and join me and take a seat. Bold action and solidarity, those are good things to end on.
Thank you.
So thank you for outlining what you're doing in Zimbabwe and beyond. Of course, you have a leadership role outside Zimbabwe as the Ministerial Champion for Climate and Health, endorsed by the Africa CDC. In that role, how are you strengthening Africa's collective voice and leadership on these issues?
Thank you very much. I'm committed to amplifying Africa's collective voice on these critical issues. My focus is to build on the momentum that was created by the Climate and Health Africa Conference that took place in Zimbabwe last year, which resulted in the Harare Declaration and those 6 priority areas that I've mentioned. I'm also working to ensure accountability for the priority areas. In the coming week, CDC Africa has already arranged a meeting where I will be making a statement and emphasizing the priority for African leaders, especially the ministers of health and ministers of environment, to implement the 6 priority areas that came out of the Harare Declaration. At that same conference, I'll also persuade the other leaders that we should actually meet maybe once in 2 years so that we track progress and make sure that what came out of the Harare Declaration is implemented by the leaders of the African Union. So those are some of the issues that I will work on, because the aim is for the whole of Africa to speak with one voice and to be able to share our challenges, to share our innovations, and move together with one voice.
So back to Zimbabwe, what barriers does Zimbabwe face in trying to implement adaptation measures?
Yeah, The first thing that I see is lack of data and research to drive us into coming up with proper policies. The second issue is funding. We don't seem to be having enough funds committed to the policies that we come up with, and we need international collaboration to make sure that our programs are properly funded and we achieve the goals that are intended by our policies. I think we also don't have enough policy and frameworks in place to be able to implement some of these priorities that we have come up with. So we really want to strengthen our policies and frameworks so that we're able to drive the agenda as outlined in the Harare Declaration.
So if you could share a message about the importance of global collaboration on climate and health, what would that be?
Climate change is real and it knows no borders. Therefore, there is need for us to collaborate and share knowledge that we have and also our innovations and solutions to solving climate change issues. I'll just give an example. In Zimbabwe, we have realized that there was an upsurge of malaria cases this year, and there is no research that has been done to say what is the cause. But we also hear that in the region, there were so increase in malaria cases. I came to this place via Kigali, Rwanda, where there is an international AIDS conference taking place. Also, the reports that I got there was that there was a huge increase in malaria cases. So what is the cause? So we need more research and share so that we can be able to tackle the challenges. Is it because of the different patterns of rains? Is there any resistance coming in our in terms of the parasite to the sprays that we do? We need research and we need to share so that we can mitigate against all these issues of climate change.
Thank you to the Zimbabwe Minister for Health, the Honourable Dr. Douglas Tendai Mombeshora. Thank you for coming all this way and giving us that insight. It's extremely valuable to get your perspective.